Hello everyone, my name is Sheila Chadwick. Some of you may know me, as others may not. I currently work at SRS as a radiation protection inspector. In my profession, we use many different instruments to detect radiation and radiation contamination. Today, I'm going to tell you about an instrument we use often. It is the Ludlam Model 12 with Beta Pancake Probe. It's also called a Beta AC12, or it could sometimes be called a 110. Regardless of what you call it, it is used to detect beta-gamma contamination on total surfaces or on a smear for transferable contamination. In order to use the instrument, you must go through training and pass a JPM, which is a job performance measurement. You must also read and use the procedure for the beta instrument. I'm going to briefly go over the JPM with everyone and then go over the procedures. Once that is complete, I will show you a brief video of the beta instrument being used. However, I did not go into full detail with using the beta instrument in the video. This is because it takes approximately 10 to 15 minutes when frisking somebody properly and doing the whole body, and that obviously would be longer than anybody wants to watch. But I just wanted to show the main points when frisking someone. So first I have the JPM, and I'll show you this. This is our beta instrument with the pancake probe. This is the beta JPM that I will be going through. All right, this has had many revisions, but it shows the objectives of it. I'll just put it in. Your prerequisites, what materials are in here, what all you need for it, and what references are used. With this JPM, you will have an instructor that will teach you how to use the instrument so that it is done properly, because obviously you do not want to use the instrument and miss what could be possible contamination on a person or an area that you will be working in. This is the knowledge and practicals on the instrument itself. It gives you information and it shows you about the probe, how it detects the radiation. Sometimes when you're in high radiation areas or even contamination areas, your probe or your whole instrument will be covered with plastic or tape or both. This way it prevents contamination getting on the instrument and then the whole instrument having to be disposed of. And this shows, and you do not want to have a plastic cover over the probe because then the probe would not work. You have to check the battery to make sure that it's working on the probe, as well as checking to make sure that the sound is on. And you'll see in the demonstration video, the sound will pick up all the beta in the background, which is completely normal. In order to pass this JPM, you have to have your instructor, you have to show your instructor that you can use it properly. They will go over this whole sheet through your knowledge of the instrument and how to perform it. And once you are finished with that, they will sign off on your evaluation on whether or not you are qualified to use the beta probe. Once you are in the field, you'll want to learn how to use the instrument properly. And so you have your procedure to do so. In the procedure, it tells you what the probe is, what it's used to detect, what it is used to, how to use it, what you would use it for, how to use it, and if there's any issues with it, how to detect what's going on, what's going wrong with it, or whether or not you have to get a different instrument because you do not want to go into a contamination area and be surveying something or someone and miss the contamination or radiation. So in the video that I will be attaching, it shows where I am frisking a volunteer's hands, checking for contamination. You check the hands first when they're coming out of a contamination area, as well as going up their arms, holding at the elbows for 5 to 10 seconds. Or then you check their abdomen, their head, their nose and mouth area. You again hold for 5 to 10 seconds to make sure they have not inhaled any contamination. Once you have done all of that, you check their back, you check their feet, tops and bottom, you check their legs, and you hold at the knees because people will obviously bend down onto things when they're in different areas. I did not show all of this in the video because, again, it could take 10 to 15 minutes to properly frisk a person, but I did want to show that the high points of where you need to check somebody. So I hope you enjoy it, and I hope that this video has been a bit informational about a beta probe, and I hope everyone has a great day. Thank you. You good? You good?
I think you should do the one where you pause for 5 to 10 seconds too.
I will, when I get to your elbow.
Gotcha.
Okay, man. Well, it picks up a lot of background in here. See what you gonna do.
Oh no.
Okay.
Turn your arm so you can look. Alright, turn around for me. I'm telling you, you're gonna get into something.
I swear, I was ready when it was supposed to be. I promise you.
I'm gonna tell Boo. Alright, and I'm gonna have you do your feet for me.
On this?
Yes, you can touch the table. Okay, that's it. I'm not gonna do your whole body. Goodness.
I'm done stepping.